We were just talking about the problem with prescription pills here on Long Island, and it's as a gateway into the heroin problem. Patty, you were just saying about the prescription pills and what you observed and the need for some changes.
Right. One of the, as Jamie pointed out, access is a very significant issue. That they just seem the streets are flooded, the medicine cabinets are flooded. We're trying to get the word out to people on our, to bring medicine to be disposed of in events such as we had in Oyster Bay, Syosset, and but they're just, the doctors give large quantities of prescriptions, which they didn't used to do, and part of that is because of the fact that that insurances, drug insurance companies tend to do better with bulk, and so people don't have to pay multiple co-pays. So there are many different factors that are bringing the volume onto the street, and they're getting diverted to youth.
Jamie, what kind of prescription drugs are we talking about?
We're seeing, it's interesting because, Patty mentioned the drug disposal program that we had that you were part of, and, collecting over 1,500 pounds of prescription drugs. We're seeing just about everything. We have kids who are experimenting with drugs that are clearly not intended for them. Drugs from high blood pressure to, for anxiety, for depression, for neuroses, for all different kinds of things. And a lot of the times these kids have no idea what they're putting into their body. They're changing the substance. Sometimes instead of just swallowing a pill, they're crushing a pill, which for some pills, for the OxyContin, that could be fatal. So clearly we're seeing kids misuse the prescription drugs too, which creates such a dilemma for us. A lot of what we have to do and a lot of the efforts that we have been doing have really been geared around prevention and education, helping parents and kids to understand what are some of the consequences, what happens, what's out there, what does it look like, how do you get it, and all that kind of stuff to try to keep kids and adults safer.
And that also leads into a very good question, is what are we doing for prevention for parents to help them be a stronger buffer to protect their children? Patty?
Well, I think in all our communities, all of the community-based NAFAS Alliance members have participated with schools, local police departments. In Long Beach, we had multiple outreach services. We did a presentation, a community forum. We worked with the DA's office. We also had the DEA come and speak at the school. We had another speaker that talked to Dr. Dewey, who talked to, the effects of drug on the brain and how. So we are trying to get the word out and trying to do medicine disposal activities. And in addition, on a larger level, as you know, Rene, we've been working collaboratively around, trying to look at policy and legislative issues that might help reduce some of the access on the street.
Absolutely. No, Jamie, being in Massapequa, you've done a number of community activities. Tell us a little about that.
Well, as Patty was saying, one of the things that I think is a strength of the NAFAS organizations is that we all work very diligently to partner with other resources. So, at YES, we partnered and maintain our partnerships with school districts and civic and fraternal and religious organizations so that everyone is a part of this solution. And that's true across the board with all our member agencies. We're all licensed and funded through the New York State Office of Substance Abuse Services. So we are guided in part, by the mission of making sure that we provide prevention, education, information to people who need, and then provide access to care. And I think that's one of the great things about NAFAS and our 24-hour, 7-day access to service, so that anyone has, if they have any issues, any questions, can pick up the phone, call our 24-hour, 7-day hotline number at 481-4000, 516 number, and they will get directed to any one of our treatment providers, a licensed and funded provider who does, who really provides quality, evidence-based treatment approaches for people.
And that we have such an organization is a real blessing. You mentioned that you're active, and we appreciate that, on the Heroin Prevention Task Force, which we've all been working together. There's about 140 members to that. And we've done a number of projects. I think most recently we did the Parents Who Matter with the Partnership for Drug-Free America. And I know you're chairing the Education Committee, and I think you're working on an upcoming event as well.
Yes, we are. We're working on getting, working with the schools to bring the schools together to help them to just take a look at some of the prevention programs and how they can better coordinate. Because there is no one person, no one program, no one entity that has all the answers. And if we don't get beyond, some of that misnomer, we have to acknowledge that we all have to work together. This is way bigger than one agency or one organization. We all have to partner, and that's why, working with the district attorney's office and the police department, I mean, that's what will make us get on top of this.
I think we all know that what works best is working together, and that's what we've been doing. Another issue came up, Patty, that you had talked about with insurance laws and with people needing detox. Why don't you tell us a little bit about some of that? It was pretty fascinating.
Right. Well, so, as I chair the treatment subcommittee of the Heroin Task Force, one of the issues we've been addressing is the issue of people, particularly young people, getting access to detox if they needed, to treatment if they needed, but particularly the inpatient crisis level of services. Oftentimes insurances are denying that coverage based on what they consider medical necessity, or the insurance company does not cover inpatient addiction treatment, so that we've talked to many parents, and they've been very vocal, even in the media, the parents themselves, that they try to bring their youth, their kids, to a safe place, and then they're turned away, or they can't really access it due to their insurance, which has been a big problem. So we are working on that issue through OASIS, through legislative issues. We're looking at all the different avenues to make sure that when someone's in a crisis, there's someplace safe for them to go.
So, if I understand it, a person who is about to go into detox is willing to turn around. When they get to the hospital, unless they're in the full throes of the detox, insurance will not cover them. So at that point, they have to wait, at which point you've lost that very important crisis point to turn them around. I understand there's a problem at the other end as well, when they have gone through the detox and they're ready to be discharged.
Yes, because oftentimes an insurance company will say that a person needs to fail at outpatient treatment in order to qualify for medical coverage for inpatient treatment. And some of the patients that we're working with are really not capable of making an appointment, outpatient, getting on a schedule. Their life is a complete disaster at this point. They might be homeless or near homeless. Their peers or have a very negative influence. They really need to be in a safe place, and we try to convince insurance companies that it's not safe for them. But the insurance companies have a very strict rule about the failing first in outpatient.
We've just begun to scratch the surface, and there's so much more. But we have to bring it to a close at this point, and we look forward to getting together again soon.